Everyone, this is Dr. Mercola helping you take control of your health. And today we are joined by Dr. Dominik Nischwitz, who has written a book, It's All in Your Mouth. He's a dentist in Europe, and he really is aligned with the right way to treat to treat the important structures in your mouth and keep them healthy and have really solid strategies to preserve your health when things don't go the right way. So welcome, and thank you for joining us today.
Thank you very much, Dr. Mercola, for having me. It's an honor.
Yeah, well, it's a great privilege. And where exactly are you now? Are you in London in Germany?
No, I'm in Germany. It's a town called Tübingen. It's, I would say, like 20 minutes from Stuttgart. It's in the south of Germany. Maybe you know Stuttgart.
Okay, so you're not trying to be fashionable, but it's 9 p.m. there. We're in Germany where we're interviewing you, and that's why you're wearing the blue blocking glasses. So my big congratulations to you, because that's helping preserve your chronobiology and really a strong suggestion. There's very few people who have the, I guess, maybe audacity to wear these glasses during interviews because of concerns about the way that it makes them not look good. But the people who do really, in my mind, are authentically committed to preserving their health in a profound way. So congratulations, kudos for that. So you are a dentist. Your father was a dentist, but he wasn't just a regular dentist. He was a biological dentist, a dentist that was not putting amalgam fillings in people's mouth, which at the time, I imagine, was well less than 1 or 2% of the practicing dentists. So why don't you give us your story, your background, and on your dad's practice, and maybe, I don't even know, maybe his father was a dentist, and how you progressed to that and how it was going to dental school knowing the alternative side.
Okay, let's start with him being my dad is a dentist, and he's still working with me in the clinic, so he's only 62 years old. And so as a kid growing up, I was very athletic, and I was not really interested in what my dad was doing, so I wanted to become a professional skateboarder and nothing else. So I was only focusing on sports, and I couldn't imagine becoming a dentist or something like that later on, because for me, just sports was what I'm focusing on. So I thought, he's only at work, so that must be very boring. So yeah, and also I didn't make it as a professional skater, unfortunately, but I was always a little bit sick, and my dad is a dentist, my mom is a nurse, and of course, I was always treated with antibiotics. I had recurrent throat infections. When I was 14, they were taking my wisdom teeth out randomly, and for braces, I reckon. And I had an appendicitis with 15, and I developed massive acne when I was also 15. Lots of inflammation. Took antibiotics. I think it caused over 6 months, minocycline, and then this nasty stuff, Roaccutane, when I was a kid. So all things I thought it was normal to be just a little bit of sick and then a little bit of healthy. I can do skateboarding, and then I don't. I would take an antibiotic. And then they wanted to take away my tonsils when I was 16. My mom said, let's take a second opinion, go to this naturopathic doctor. And back then I was just a 16-year-old skater, and I thought, this is something woo-woo. But I anyways went there because I didn't want to go to surgery again. And he tested me with kinesiology, and that kind of felt right for me. And he told me, you're just allergic to milk. Skip this and take this chlorella here. This is an allergy. And I just did it. Back then I didn't realize that maybe I was doing something wrong with my lifestyle, but it helped. My tonsils are still in there. And it took me a few more years to, actually look into dentistry, because when I was at civil service, I was at the Red Cross as I think it's paramedic in English, so I had to rescue people. And you have to do an internship in the clinic. And I don't know why, maybe it's coincidence, they put me in dental clinic. And I was sitting there, and besides all these students, I found out later, and the doctor just picked me to take out teeth randomly, because he thought I'm probably a student in year 8 or something. I didn't even know, so I just took out 15 teeth from a patient in general anesthesia, and I liked it. And I don't know, that kind of like clicked in my brain. I thought, okay, why not just apply it to dentistry? Because I knew at least that I'm very skilled with my hands, and I knew my dad is also, it's something that you have to do, like pretty tiny basic or like tiny craftsman things. And aesthetic dentistry also appealed to me. So I just applied to university, didn't even know that I had to learn chemistry and physics and sciences. I just thought it's going to be about the craftsmanship. So I applied to university, made the cut, and started without knowing anything. And had to learn chemistry and biochemistry and all these things, and finally got interested, because at the same time I was starting to go to the gym and started working out, because I just wanted to perform better. And that's when I started finding out about nutrition and diet by reading a random bodybuilding magazine. And there was this very muscular guy on the front of, I guess it was a Flex magazine, and it was just saying, eat 3,000 calories a day to gain mass. And I wanted to gain mass, so I just ate 3,000 calories. I didn't even know what a calorie was back then. I just started reading the back of the box, and noodles had quite a few calories, and tuna. And I'm kind of like an extreme guy, so I just went with noodles and tuna for a straight year.
Yeah, high carb, high mercury diet.
Yes, basically, perfectly according to what we did in university then. And I gained 20 kilograms of, I wouldn't say muscle, but at least I made it from 60 kilograms to 80, something like this, because I was always very skinny. And this is also how it all started. And I went to dentistry anyways, and I was very good with the fingers. So the skill set was there. So I was always very fast in the practical stuff. But still, at the end of university, I was missing something. So it was like intense semester. This is one semester before the examination. I told my dad, I'm not so sure about this job. I think it's great. I have the skills. I like the tiny stuff, but something is missing. I don't even know what it is. And he just said to me, I know he was a little bit afraid that I was going to quit or something. He just said, hey, Dom, this is just your entrance card. You will decide after what you need to do, because the stuff you learn in university, most of it was already outdated when I was in university 25 years ago. So you can go, you have the skills, you will just see what's coming afterwards. And besides university, I was, of course, trying to find out all tricks possible to help my body grow muscle and get I didn't know that it was health that I was missing. I was just focusing on performance and, of course, muscle gain. Maybe it was just an aesthetic thing, but I learned everything about nutrition that you can find out there. I tried every possible diet. I used every supplement. I was the guy in university who had his box of food always with him, not even knowing that it maybe was also too much carbs, not even the quality I should have eaten, but I learned a lot from this. And when I did the examination, afterwards you have to do 2 years of, I don't know the word in English, maybe it's a tendency at another dentist. And I had the chance to...
So an internship, we call it, or a residency.
A residency, that's the word I was thinking. Okay. And I did a residency at a very skilled surgeon, because I wanted to do oral surgery from the scratch. I don't know why, but this just appealed to me. I just want to do surgeries. And Dr. Wolf in Moosburg, and he accepted me as his resident, and he was doing amalgam fillings. And yes. And I learned in university that how they work. We actually worked with amalgam a little bit, but not too much. And we learned that's the perfect material. It's lasting forever, and it's easy to apply, and it's for free because the insurance pays for it. That's what I learned. And you shouldn't use it on children and pregnant women. That's basically it. But for me, aesthetically driven, I just told him, no, I can't do this. It's so ugly. I learned about composites and I learned about ceramics. So I won't do amalgam fillings. And he's like the boss, and the little guy on the first day tells you, no, he doesn't do what you do. It was a little bit weird. And I also remembered my dad telling me that he's not using the silver fillings ever since I was a kid. So I think he stopped that in 1992. There was kind of a big of an amalgam discussion back in the 90s. but it didn't make it. It's still, in Germany, it's still a regular stuff that gets paid for insurances, in Germany at least. And yeah, I told him I won't do it and I will find out new ways. So I just started this. But because I told him...
What was the motivation at that time purely cosmetic, or was it for health reasons?
For me personally?
Yeah.
It was initially, I think first was aesthetics, and then I had to look it up because I told him I won't do it. And because I was so much interested into health and health optimization, I initially looked up, I looked in YouTube and I found Dr. Dietrich Klingert, my first mentor, and Dr. Joachim Mutter, German doctors. And I basically learned everything I could find out there. It kind of made me, so this whole amalgam thing totally clicked with everything nutrition-wise I did in university for me personally, with all the supplements. I knew all the bodybuilding supplements, the sports supplements, amino acids, you name it. And you had to study biochemistry and chemistry. And basically, because I had to learn that from scratch to just get it in university, in dentistry, everything is an oral examination. So I really had to get biochemistry. And I was really good at it because my brain just thinks like this. So it was easy for me. And then a whole new universe opened. So finally I was able to see, whoa, this is the stuff I learned from me. Now I'm able to use all this knowledge. And because basically heavy metal detoxification, all these things is biochemistry, and has a lot to do with supplements and nutrition. So it clicked and this universe opened. And I would say I became addicted. And I was on like YouTube articles. I was researching, I would say every minute in my residency when I wasn't drilling out amalgam fillings, I was searching the internet for stuff to remove, to detox, how all these liver phases work, like basically everything possible. And you find Dr. Dietrich Klingert right away. And yeah, so I thought the first year, I thought the holy grail to help people getting healthy. I thought I found the holy grail, and this will be the removal of amalgam fillings. It wasn't, I found out. So of course I told all my patients, okay, you have to do this and this kind of nutrition to help your detoxification. We need binders, we need chlorella, we need everything. And of course, I removed everything as safe as possible with the rubber dams, etc. But what I didn't, and I helped a lot of patients. They really got better, but a few of these patients got really, really sick. And I found out through just basically empirically by doing it that patients need to be prepared, and that a lot of them, and I invented a health scale, from 0 to 10. If 10, it would be optimal health. Most of them, in terms of absence of disease, are only, from a scale from 1 to 10, they're only on a 1 or 2, and they barely make it. So if you start detoxing or something, they might be blocked underneath, or they're in sympathetic nervous system or parasympathetic, or they're just lacking nutrients. So they ended up being or puking over the weekend, and the same from the back door. And my boss back then told me, oh, Dom, what you did with this patient over the weekend, they came to me and they don't feel very well. And I know you, he told me, you're in Protestant and I'm Catholic. The stuff you do, you just have to believe, but stop this, please. And I also thought, if you're a residence doctor, very young from university, and the patient gets sick by stuff you're doing, you really feel very bad inside. Kind of like, why am I doing this? I always was like, oh, why am I doing this? Super nervous. And like, because I didn't have all the experience. I just tried whatever I've learned. Why am I doing this? But at the same time, I had this inner calling. It was like, why do you not just drill a hole like you should do as a doctor and put a filling in it? I had this inner calling to help these patients and find out more. So at the end of the first year, having helped a lot of patients and finding out about all the problems patients had because of not being able to detox, I will tell you later what I found out, how that works and why it's working now. I went to see Dr. Dietrich Klingert in person. It's 10 years ago, more than 10 years ago. And I have asked him all my final questions. Basically, like, I was sitting there and I was asking him, Dietrich, Dr. Back then I couldn't say his first name. I was just saying, hey, I'm Dr. Dietrich Klingert. I'm just a dentist. And am I allowed to do all these things? Because he was sitting there in his underwear and injecting venom. I know you know him. Injecting bee venom into his, I think in his thighs or something, neurotherapy. And I was like, dude, this is amazing. I want to do that. And I just went to him and said, hey, is this something I can do? I'm only a dentist. And he's like, now you have the moral obligatory to do this and tell this to your patients and do it for your body. This was the first thing he told me, and I remember this as it was yesterday. And the second thing was always, but don't be John Wayne. Search for a big team. You cannot do this on your own. You need lots of people. And I told him straight away, okay, I'm going to be the guy who explains it to all my dental colleagues, because I'm very school medicine oriented also, but I'm just open-minded, and I search for everything that helps health, actually. I would say a health enthusiast. So I'm not like brainwashed from university. I was always thinking, why am I learning this? Not in terms of why do I have to learn because it's university, but why am I learning all this stuff and who invented this? This was always a question in my mind. So I was really curious to find real solutions. So having said that, on the next day after this course back then in Austria, I went to Vienna to see him. And I went to the pharmacy and basically bought me Procaine and all the stuff I needed to give myself IVs. And as I was trained as a paramedic, I remembered, okay, 5 years ago, I did some catheters and injections weren't a problem. So I just started injecting my chronic shoulder pain. And I injected just random spots on my arm that hurt and I was pressing anyways with the neurotherapy Procaine. And I found out always when I injected these acupuncture points, my upper first molar would hurt. So I just thought, okay, why not just inject my molar? And I just injected my molar, this upper right molar, and it's like perfectly fine molar, just because I'm just having a bad bite. And I injected this for six weeks straight and the shoulder pain went away. So I was already, having something there. So I thought, okay, why not just learn neurotherapy? So I booked a course with Dietrich in Seattle in 2011 and flew there over the weekend and learned basically everything you could find out for injections. And finally developed, it gave all the patients like a nutritional consult and I put them on supplementations. Of course, I removed all the amalgam fillings, but I was a surgeon. So I would do titanium implants and of course I would do wisdom teeth removal, etc. And I learned all the oral surgeon skills. So I basically knew everything by now besides the holy grail amalgam fillings. I knew about root canal problems. I knew about the metals overall, not just the heavy metals, but also like gold problems and titanium. So I was not feeling too comfortable with putting the titanium implant instead of a root canal. So I just stopped that right away. And I did the whole aesthetic dentistry curriculum, and this just bored me because there was nothing new. It was just techniques. You could show me a technique in a second because I'm very good with the hands. I will probably just copy it and just do it kind of like a trick on a skateboard. So it was just boring for me. And at the same time, I went to LA and did a functional medicine course at the IFM. It was called I think the AFMCP week. It was 1 week and there was very great doctors. And then I applied all the functional medicine stuff. And there were times then I thought, maybe I'm just going to be a consultant. And I found, I did so many like certifications or like weekend programs because I was just searching for new things. Like, as I said, like an addiction, how to optimize. And of course I learned from Dietrich the 5 levels of healing. So I wasn't only searching for stuff on the physiological level. I was already doing all the acupuncture stuff, the neurotherapy. I was interested in the mental field. I was interested in spiritual health. So the full concept. And then I had a little bit of a timing because I had to quit one job because of a new offer. And it wasn't so good. So I had a little bit of time and I did the whole Klinghardt ART courses and the MFT, maybe from Dietrich, his whole course series. I did that. And doing this course series, I found out about another guy who was doing ceramic implants. And I was like, whoa, ceramic implants, that sounds good. So I booked an internship with Ulrich Volz for ceramic implants. And when I arrived there, at the same day in his clinic, there was Dr. Joachim Mutter, and Ulrich Volz was doing ceramic implants. As a surgeon myself, I looked at him, and in 5 minutes I knew he's a great surgeon. He's placing white implants. So from this point on, the full concept I was thinking about in my mind for the last 5 years was finally there, and we were just talking the whole day about the stuff I did the last 10 years, about the nutrition and everything I just told you about. And he basically asked me at the end of the day, is it somewhat possible that you work with me some kind? Because then I was working in my dad's office and with him, and I did this thing called flying implant service. So you could book me as a surgeon, because I didn't have my own clinic back then. You could book me as a surgeon. I was doing flying implant service at Paracelsus clinic in Switzerland. I was doing it, I would say, in 6 different clinics. You just book me. And I don't even know the patients. I don't even know the nurses or the clinic. I would just drive there in the morning, 5:30, with all my stuff, and would do just surgeries the whole day. And at least 20 ceramic implants per day was my mandatory, because I just wanted to have a routine in surgery with ceramic implants. I didn't charge a lot for the implants. I just wanted to do numbers to just get good. These were, you can imagine, these are super challenging days. So nobody. I didn't take my nurses with me, just my instruments, and then just went there and did the full day of surgeries. And this got me like to a good skill level pretty fast, because I was doing so many implants. Let's say in the first year, already 1,000 ceramic implants. So I didn't count anymore after a few thousand ceramic implants, but it's a lot. And this just made it second nature for me. It's just like skateboarding. It's kind of like being an athlete all the time and just wanting to become a little bit better every day. And this is a skill set. But the ceramic implant were just my neutral alternative for root canals and titanium implants. So I could finally see the full concept, and then working with Ulrich and all the other good guys, and finally getting Dietrich to know better. It felt like the rookie of the year, and this was already almost 10 years ago. So,
well, have you modified your protocol for root canal therapy, post-root canal therapy? Because that's what the ceramic implants are for. I just interviewed recently a periodontist who's biologically oriented, and she was explaining how she uses these YAG lasers in photoacoustic therapy to sterilize the existing tooth.
Okay.
Because ideally, you'd like to keep the structure there itself. And it seemed to be really intriguing. She has some excellent videos on how this was accomplished. And it seems to be the state of the art. And I'm wondering if you have any experience with that.
Yeah, so we do it, I think we do it a little bit differently and very consequent. So the concept we now developed over the last years is called, so it will lead up to a therapy which we call all-in-one concept. So what we are going to do, or trying to do, is we will take your whole mouth. So let's do it just a regular patient. So a regular patient applies for an appointment. I cannot see you in person for a long time anymore, because it's so many inquiries, and a lot of them, at least 50%, are coming from all over the world and from the US. So we made it easy virtually. You will just send a panoramic X-ray, your medical questionnaire, and your vitamin D3 and LDL blood work to just have a basic knowledge. And then I will just do a full all-in-one concept, meaning we will remove all the oral interference, all the challenges there, the same. Metals, root canals, cavitations, we restore the bite. We check for all these things in one, let's say, appointment sequence, which is called, maybe you can call it a health optimization week. But to do this, you have to be prepared. So I will plan this whole case and just basically draw into your panoramic X-ray. Then we remove the root canals, we replace them with the ceramic implant. I will explain this in a second. And we take care of all the cavitations, which are, cavitations is the layman's term for fatty degenerative osteonecrotic jawbone, or CIBD, chronic ischemic bone disease. It's also known as NICO cavitations, neuralgia-inducing cavitation osteonecrosis. Problem here is that you don't learn this in university. This is still not medically accepted. even as my good friend, and I would say the pioneer in this field, Dr. Johann Lechner, is doing research here for over 40 years now. Still not accepted. It's a bit of a problem with, like, let's say the rulers there. But I'm doing this every day, so I will explain this. And then you have this panoramic. You get an email where you can see everything that we were going to do and how we're going to do this. And the ceramic implant is only the bonus. So what we need to do first is take out the oral interference as minimal invasive as possible. So if there are any metals, of course we remove them under safe, under all safe removal possibilities they're existing. Not just the rubber dam. We will use rubber dam. We have a special device, a suction called cleanup suction, which has a integrated, it's a better suction. It goes over the tooth. It's from Scandinavia. We have a big outside suction device. It's called an IQ Air, which takes about 99% of the mercury vapor or all the other metal ions that are going to be removed. The rubber dam is basically just for the big parts. So all mercury vapor goes through at least 6 pairs of latex gloves. So the rubber dam won't help there, but the suction will. We will have nasal probes and apply not oxygen, not just regular oxygen, like just regular air, not oxygen anymore. And of course, if possible, we will just break out the filling so that we don't even drill it. So everything that's possible. Then on the next day, we will remove. The surgical part will be my part. So the metal fillings, the other dentists do the metal fillings. We do lots of IVs, nutrients before to help the body when you hear. Then we remove the root canals and cavitations. And I'm a surgeon, so we trained as big surgery, biggest surgeon, biggest cuts. We don't do any cuts if possible, because every cuts and all these vertical incisions will basically make scar tissue later on, which could totally disrupt your whole autonomic nervous system and, of course, the whole blood supply. So this has to be very minimally invasive. You use piezo surgery, and the goal is to conserve the whole anatomy as much as possible. So if you can, the root canal is anyways a dead tooth. It's a dead organ. It's not even, there's nothing anymore there, so it's already dead. We just take it out. We clean the whole socket with ozone. We use neural therapy, procaine, notaquil, selenase, arthrochelain A, and rinse it. We will draw blood before the surgery and spin it in the centrifuge to make APRF membranes, which are kind of like platelet-rich fibrin or PRP membranes. They are containing stem cells and growth factors to place it in the socket or besides the implant or in the cavitation later on. And then if everything is clean, then we will use a zirconium dioxide implant, which is not colored, so there's no metal oxides in it. It's a completely neutral healing stone, Didrik would say. And the good thing is it only osseointegrates if your body is able to build bone, and the part that will come up in a second, and if everything is clean. Because if you, for example, miss a cavitation, which is always, or most of the time, let's say at least 90% underneath the root canals, you have to go higher or underneath the root canals, because maybe there's at the tip is a cyst, but lots of times there are huge bone edemas or osteolytic processes of FDOJs above, so the immediate implant will help you get there after disinfecting with ozone, etc. Imagine the ceramic implant as a neutral component, kind of like a tent pole that you put in there, or a plug that preserves the whole socket. I call it socket preservation 3.0. That's what the cool kids do. Just kidding. But it actually holds the whole anatomy and the whole tissue and bone. Because, if you remove a tooth, this is what the regular dentistry does in our strain. You remove a tooth, and then you will just let it heal for 3 months, and then do a cone beam, see that the bone is lost, and do a bone graft, and then the implant, which is titanium, which makes no sense. Because if you have the socket, it's all clean now. Everything is disinfected. And then anyways, your body has all the growth factors there, so it's now the time to heal, and then you place the implant as a tent pole. You actually build a bone container there, and the only thing that's possible to grow in there is actually bone. have to make them stable so that they don't move. Kind of like you need a cast for at least 3 to 4 months to help osseointegrate, but you at least conserve the whole anatomy, and basically you don't have any surgery at all because you just took out the tooth and made this very, very specific and simple so that your body is actually able to heal. And then you use the ceramic implant as a healing device. And that's why I say to patients, okay, first of all, we will take care about your health. So we have to take out all the let's just say trash. And then your body will be able to heal itself. We use everything that's possible in terms of, let's say, neutral elements. And then your body just needs time to osseointegrate. So before doing this whole concept, the patient gets prepared. So I've written a food design concept. There's also 40 pages in the book about nutrition. It's basically the same stuff you would do for a patient or every other functional medicine doctor. It's more like go as natural as possible. It's what you can hunt, what you can fish, what you can find. And it's basically the 20 years of nutrition information I have in my brain. I wanted to have it in 10 pages because most people don't like to read, and then it has to be super simple. So I have 2 charts. It's a red chart and it's a green chart. The red chart basically is food intolerances and food toxins, and there's the right side is always the alternatives. We of course go grain-free and dairy-free, and then there's a green chart which is based upon macronutrients, protein, and I named it healthy carbohydrates, healthy fats. Then we have fruits and vegetables. And initially, because this is just what they read before, and they have to start with this. And because I'm always a big fan of food comes first, so this is the basics. And of course, I've developed a protocol called Bone Healing Protocol, which is micronutrient tuning. And it basically evolves around 20,000 IUs of vitamin D3 a day to get the patients from normally around, let's say 10 to 20 nanograms in average on my patients, and they're mostly chronic sick patients, to at least above the average, which is above 60 nanogram. And I think in the US it's the same. So 70 would be amazing. And if you start 4 to 6 weeks prior with this protocol, and it's not just 20,000 IUs of D3, you cannot do this. There's, of course, the right amount of magnesium, the right amount of vitamin K2, all the activated B vitamins, you name it. It's all in there. That's my biochemical background. So they come in to this health optimization weeks already immunologically boosted. The nervous system is already very good. And what we're trying to achieve then is bring the patients from chronic sympathetic nervous system mode into parasympathetic, using high doses of vitamin C, IVs, all these things, taking out the trash, being prepared, and then I'm going to individualize your, I call it food design or lifestyle concept, after surgery, because then I know, then I see you in person. I can see, okay, do you have a little bit of a metabolic problem? You have too much body fat in, how does your body composition look like? Do you have too much body fat in the middle, or it's maybe more the legs or whatever? What is your problem with sleeping? How about your neurotransmitters? We will maybe do the Braverman test. And then I just structured it in terms of being anabolic then, because I need them to grow bone. And a lot of it because cavitations can be, and I can tell you the patients from the US have bigger cavitations. It's a huge problem there because of all the pesticides, glyphosate, and mold is a big thing. And you can see that in the cavitations, they just look different. I will tell you in a second. And you could end up having just 4 cavitations, and if I remove those, it could be about 8 to 10 cubic centimeters of fatty degenerative bone or chronic inflammation in your jawbone, which of course disrupts your whole system. And I know the whole field of health optimization, biohacking, we're anyways talking about heavy metals, and we're talking about chronic inflammation and cytokines. And these inflammations in your jawbone, they're chronic, and they're there because of things installed only for the reason that biting is possible. That's how a dentist is trained. A root canal is perfect if you want to just bite, but from an optimal health point of view, it's a dead organ, and you have to see a little bit, is a big of a challenge. But now, as we
let's start here, because as far as I understand, and I don't remember the specific numbers, but I believe there's tens of millions of root canals performed every year in the US alone. And that procedure can be performed by a regular dentist. They are taught how to do it in dental school, as you were. and there's no specific subspecialty training that's required. And the periodontal specialist that I interviewed was really opposed to them having these being done by a general dentist, because the process you just described was people who've already had a root canal being done. But there's the pre-root canal phase where there's potentially an abscess, a periapical abscess that's there, and they're in a lot of pain because of that abscess. So the only therapeutic option that the dentist typically has is to do a root canal, and that relieves the pain, but it kills the tooth. So what I was referring to earlier is this YAG laser. It's a very high-powered laser. It costs well over $100,000, and it combines not only the light therapy but an acoustic sound wave therapy that integrated together perform this unbelievable sterilization process. And it's actually, I believe, typically integrated with ozone. So that combination is able to rescue a large percentage of these teeth from actually having to have a root canal performed in the first place, which to me is the basis of a powerful intervention strategy. Because what you're describing is a rescue effort, and there's certainly a need for that, and people like you and many other to rescue the damage that's already been done. But I think there needs to be loads of effort towards the preventive component, so we don't need to rescue the tooth.
Yes, yeah, 100%. Oh, maybe I didn't understand that correctly. Yes, 100%. So, of course, I would say a little bit different. So if the root is already if it's hurting, so if there's a cyst underneath, I would probably say it's maybe already dying. If you can really rescue a dying tooth with the laser, I didn't try this, and I certainly didn't hear about a tooth that is
I will send you this interview I did. It was really amazing to me, and I had never heard of this process before, but apparently it's not widely appreciated, and I think there would be a great benefit to adding that to your clinic. They're not inexpensive piece of equipment, but it would be a really great tool to preserve it, because the ultimate implant is the person's own tooth.
Yes, the best option is always your healthy tooth, but it's a little bit of a different. So a healthy tooth means you didn't even have a drilling before. There was no cavity,
right. Yes.
Nothing.
Right.
Which
is not the case typically.
Yes, and if you have something on your root canal and your root is super inflamed and hurts like hell, I'm quite sure that you had a big cavity or something restorative done. And you notice if you had an amalgam filling at least once in your tooth, it's never going to be as 100% healthy. And there's so many teeth, it's really difficult in terms of chronic sickness and chronic health, that are we call them mercury toxic. They're kind of alive, but not really. And it's super difficult because the dentist only has one thing to do in terms of seeing is the tooth okay or not. Does it react to cold or not? That's basically it. If it's hurting like hell, of course, most dentists will perform a root canal. Actually, that goes as far as doing a root canal on a tooth which hasn't even had a cavity. And now we're talking because why is this going to happen? So I have a nurse right now. I had to remove a root canal. She had it for a long time and it was really interfering with the system. So rescue, like you said. But why did she have a root canal in the first place? Because it doesn't seem like there was a big cavity. So the tooth was hurting. So now you have to see the other way around. So first of all, your teeth are organs that are connected to your whole nervous system and basically are part of your brain, kind of like your eyes. And you have this massive brain nerve there, which is called the trigeminal nerve. You know, it's a cranial nerve and it's 1 out of 12 and it takes 50% of the space of all the other ones. So it's quite important. And every tooth is along this. And if you do, for example, a nerve block, which I don't perform here, you know it from the dentist, you will have a numb lip here because you blocked it over there. So basically all the teeth go numb, but it's coming from the back. So I've seen a lot of patients having teeth hurting, like the teeth were hurting because of these so-called cavitations being in the back of the jaw, and radiating pain goes through the teeth. And of course, if you're not trained to see this as a dentist, and your patient comes in with pain the 5th time, you will probably say, okay, the only solution you have against pain is probably do a root canal, which is a huge problem because, like you said, the best tooth is your regular healthy tooth, and your body is able to heal your tooth and actually to reverse cavities if they're not too big. And of course, then you have to go onto your lifestyle again, because nowadays we know from research, last year came a lot of research about vitamin D3 and cavities. So we know that if we have a lack of vitamin D3, because we have a problem with mineral displacements and stuff, and we will have mostly kids actually, cavities in our teeth, or these chalk teeth, or MIA, like molar incisive hypomineralization. It's all depending on vitamin D3, on amino acids, and of course on all these minerals. So you can check there. What we would do if you have a tooth that just hurts, we will just look, is there any interference maybe from cavitations? Or what about your lifestyle overall? So then we will see the mouth again as a mirror for your overall health, because teeth can also hurt if you just have super high blood sugar. They can also hurt by low blood sugar. They basically hurt when your whole pH level in your mouth changes, or if you're just lacking minerals. And then if you go to the dentist, just yesterday, a friend of mine, he doesn't live here, but he knows how to treat. He just asked me. So I went to a dentist and we did x-rays, and I have, between all my teeth, I have cavities. And they want to do 12 fillings. And I told him, okay, I would normally just check why you need fillings in the first place. So what about your diet, etc. Just send me the x-rays. And he just sent me the x-rays, and I would only do 2 fillings there, which are already existing and basically had secondary caries or decay underneath like an open filling space.
Well, let me interrupt you here for a moment too, because there's another strategy that you can use that I encourage and advise and recommend people seriously consider is ozone therapy. And you can get this yourself. And it seems, at least in my personal experience, that it's been able to abort many potential scenarios where I may have had to have a cavity. And I just use the ozone persistently, and literally a few days, the pain is gone. It's just an amazing, inexpensive, very safe tool. You just have to be careful that you don't breathe the ozone in, but it's very effective.
Yeah, ozone is amazing. We also have an ozone machine to do auto hemotherapy or whatever you want to use. If you use ozone, I told you a lot.
Sure. Yeah, but that's professional. This is something the patient can do at home.
Water then with this.
Yeah.
But ozone is amazing, and what you can also just see. And I saw his X-ray, and he just had these tiny initial cavities, like very initially, which I would never drill. I would just then check, which is also all patients out there can do. Test your vitamin D3 level. Is it maybe too low? What about your diet? Are you eating lots of sugar, like the regular dentist stuff? But maybe do you have too many fluctuations? What about your minerals? Because your body is able, through the saliva, to remineralize your tooth. That's a very fast process actually. And also from the inside, which is your pulp. Your pulp is in your living tooth. There's the nerve supply, the blood supply, the lymph supply. And of course, if your blood is full of, let's say, amino acids, minerals, nutrients, of course your body can pick and choose and build stuff. But of course, if you deplete it in any kind of nutrients, I would say protein is probably the most deficiency in the patients, at least I see. And of course, vitamin D3 and minerals. If you just refill them and change your lifestyle, you will end up having not hurting teeth, and your body will be able to remineralize these teeth without the use of any chemicals. Of course, depending on size and shape of teeth. And also the second point is the gluten intolerance. That's why we always have to go grain-free and gluten-free. These studies are done a long time ago because people with celiac disease, they end up having lots of these very mushy or chalk teeth. Like I've seen one patient when I was just out of university. It was a 12-year-old boy, and he had these super soft teeth. And I just knew from university, okay, this symptom is called molar incisive hypomineralization. That's basically what I knew. And then I knew how to repair it. And I had this very bad feeling in myself that this little 12-year-old dude needed a root canal treatment on his first molars, which just came out. I didn't know about gluten intolerance or celiac disease. I didn't learn it in university. I would have helped him anyways with this, because your teeth, if they're like mushy, it's kind of, they can remineralize. It's possible. Best and Price showed this already 100 years ago. So, but of course, the information is lacking. Do
you have any children?
Yes, I have 3 children.
Okay, how old are they?
3 boys. And the oldest one is 5. The second one is going to be 3.
Okay, perfect. And that's perfect. So they don't have their permanent teeth yet. And
no.
this is the question I have for you, because there are many people watching this are if they're not in this situation, they may be grandparents and have children in the same age group. And I think this is really the crux and maybe the most important point is what I'm curious as to what your belief system is, that if you can optimize lifestyle through sun exposure, vitamin D, minerals, proteins, avoidance of toxins like
Yes.
gluten, and in many cases milk, and certainly glyphosate and other poisons, and give them an optimal diet and lifestyle, do you think it's possible to avoid all cavities?
I would say yes, 100%.
Okay. Yeah, because there are cultures like Korea, which for some reason, I mean, I believe the incidence of cavities is like less than 5% of the population, which is just astounding. But nevertheless, that's the case. So I'm glad we're in agreement, because I think that is the key.
Yes.
And I just don't know what the best way to impart that wisdom on the population is, because what you're doing is fantastic. I mean, you're functioning at a very high level. You're in the elite biological dentist community, and there's certainly a need for that. But what's even more important is to treat the kids your age, to teach them how to live a life so they'd never need those services.
Yes, that's basically what you need to do. And this is why it's so important that all this information comes out. And that's why I devoted a whole chapter to the nutritional part, because also it starts actually even sooner. So I call it the health starts in your mouth concept. And basically the biological dentistry I would say it's more like overlap of functional medicine, biohacking, and high-tech dentistry with the goal of optimal health. So I'm a big fan of the basics, and the goal is actually in the lifestyle. So when you go through the womb, you already have a microbiome, and you get your microbiome from your mom going through the vagina and getting her microbiome in your mouth. So the mouth is really...
Assuming you don't have a C-section.
Yes, if you have a C-section, it's totally different, because you get mostly maybe the skin bacteria, but also, of course, the germs that are in the hospital.
Like MRSA.
I don't hope so. And the next thing will be breastfeeding. And my kids, I don't know, my wife is pretty good at breastfeeding. So they were fed, I think, at least 18 months, which is super important to grow your whole jaw. So the sucking, you need, I think, let's say 10 times the strength to suck on, on a nipple, instead of on the milk from the formula. And this sucking develops the whole lower jaw and the whole muscles there, and also will grow and shape your palate and everything. So if you see my kids, they have this wide-shaped angle. I don't know how it will work out when they are older, but we apply all the lifestyle rules because I'm doing this for such a long time.
Just like the pictures in Weston Price's book, Physical Degeneration, Nutrition of Physical Degeneration.
Exactly the same. They look like this, and they actually even have space in between their teeth. So I was the opposite. So I had not a good diet and everything. And I needed braces twice. I actually even did braces when I was in university as a study. I had them inside. They were called incognito. It was just the hell. I was just...
So this is an interesting point, because your father was a dentist and he was relatively enlightened. And what do you think the biggest difference is between the way your parents approached this and the way you did? Was it that you just were intellectual, more curious, or innovative, or I mean, why the difference? Why didn't your dad and mom get it?
No, it's a huge difference. This is more me being an extremist and extremely intrinsically motivated, because at one point I was just so sick that I had to find solutions, and I was just seeing it as a challenge and took this, and just I'm an experimenting guy, I would say, and really extreme. So if you tell me something, I will do that 100%, being a super soldier, and find out everything what I can learn there, and then I will do the next phase and integrate everything. So it's just I think that's just my passion and my personal...
Well, probably the fact that you're an athlete too. I think that had something to do with it.
That I'm an athlete too?
Mm-hmm.
Yeah, the athlete's mindset or the skateboarding mindset is more like fall and back up and fall back up. So
well, it's just it's the commitment, the discipline, and the desire to excel at a very high level.
Yeah, that's maybe just also my personal shape that I would say probably, dopamine dominant, acetylcholine individual. A lot of drive. I did my Braverman test. I had to. So when I crashed when I was 22, I was like, just normal, just not normal anymore. I was just asking for a solution, and it took me quite a while to figure out what was wrong with my brain.
Were you wearing a helmet?
No, it wasn't. It wasn't a crash for skateboarding. I just meant I crashed kind of like.
Oh, okay.
In terms of health.
Yeah. Did you have any head injuries when you were skateboarding?
Not from skateboarding, but I had a massive head and neck trauma when I was 14 from snowboarding, when I basically jumped down a huge cliff, and I ripped off almost my whole head. And this head and neck trauma, this head and neck trauma basically hunted me actually since now, and on my health journey and like learning from all these levels of health, this trauma was one of the roots of everything. So I remembered being how I was when I was 14. I was just a guy just doing it. You would tell me, okay, do this kickflip on a skateboard, these 10 stairs down. I would just do it. Wouldn't even think about it. That's just how I am.
You're invincible. That's true for almost all adolescents.
What? Yeah.
Yeah. That they just don't understand death or permanent disability.
I didn't, but my brother, he's actually younger. He always told me, Dom, just check the ramp. What is afterwards in the snow? Maybe you cannot jump over there. And I was just already flying, and had fun with doing this. But then after this head and neck trauma, it's just in retrospective, my whole physiology changed. So this just doing mode was off. I was just constantly thinking in my brain. I was drawn to doing alcohol stuff, and I was just negative in my brain. And then all these things developed, appendicitis and acne, all these things. It took me 20 years to figure out that this is one of the roots of my problems, because I was just
sure. It's, we call that traumatic brain injury. Have you ever looked at hyperbaric oxygen therapy? Because that's a pretty powerful intervention to get to address the neurodegenerative changes that occur in that type of trauma.
Yes, actually, my man and Tim Gray, he is also a mutual friend, I guess. He had this clinic, and I'm going to bring one in my clinic pretty soon, because it's so good also for the surgeries. I didn't do it for me personally for the head and neck trauma, because I tried all the other things, and head and neck trauma doesn't come up anymore. So it's a lot of osteopathic treatment. Yeah,
but there still may be some changes there. You may want to get some assessments on.
So everything I do, basically, I try on myself and see how it works. And then later on, I have the moral obligatory to tell it to my patients. And I will always try to bring the next level equipments and recovery tools to make like the clinic even better for everybody, for me and for everybody. So my priority is just optimal health.
Well, you're doing great. I mean, you're a rare bird who you really are seeking. You're a truth seeker, and you don't accept the conventional wisdom. And there's not many people, healthcare professionals, who have that courage to implement that action. And then as a result, you make great innovations, because you're in the trenches and you're trying new things, and you discard what doesn't work. So it takes a rare individual to put that all together. So congratulations on what you've accomplished.
Thank you very much. I just try to give my best every day. Yeah, but I guess thank you very much.
That's what it needs. That's what it needs, for sure.
And it never changes, so I'm always...
It's a journey. Yeah, you're always learning. The journey never stops.
No, that's the good part, right? This is what's so fun. The good thing is, I'm only 37, but I do this since, I would say, almost 20 years, and I didn't even know the word biohacking since 1 year ago. 1 year ago, there was a patient coming in from New York City, and I was, of course, I'm like this with all my patients. I don't belittle my patients or talk down to them. I just on the same level, and we were just hanging around the whole week and had lots of fun in my juicery and everything. And you were saying, and you were kind of like the German Dave Asprey and Tom Bilyeu at the same time, and I didn't even know these names. So I was like, okay, thank you. I will look them up. So now, of course, and then a few weeks later, the German biohacking community, which is Flow Grade, did an interview like we do it now, and they told me, okay, you're probably a big biohacker. And I didn't like the word so much. I didn't know what it means. So when I was invited to the Health Optimization Summit from Tim, I liked the word health optimization. And now I also get the biohacking. And of course, as I'm the skater and a cool kid, I also like the biohacking. So I understand how that works. And I think that's why biological dentistry is just I'm actually trying to go away from this dental thing. It's more like we optimize your health by starting from the mouth, which is the entry to your whole system. And you know about leaky gut, for example. Everybody talks about leaky gut, but nobody talks about leaky gum. The gum tissue, the gingiva, this is the same tissue. It's squamous tissue. It's the same as the outside skin and, of course, the whole inside. And if you have a chronic gingivitis, for example, just from a lack of nutrients or maybe from the wrong restorations in there, you will have an opening into your system because gingiva is outside. Your bacteria are not allowed, they cannot go really inside. But if it's opening, or if you maybe have a titanium implant where the tissue doesn't grow on top, you will always have kind of like a huge gap or Niagara Falls for all these bacteria and mainly anaerobic bacteria, which will travel into your system. So this is basically leaky gum, leaky gut. It already starts there because the gut basically starts in your mouth,
Sure.
right?
Speaking of that, as you age, there's a tendency to get gingival recession.
Yes.
And I'm wondering if you, in your biohacking efforts or health optimization strategies, if you've encountered any good tips or tricks to accommodate that, other than periodontal surgery.
Yes, recession is a little bit difficult. You have to see if it's too much of the dental tubules that are open, then you probably have a little bit of a sensitivity, and that's one reason. But you could use again. So there's nothing that works that you can apply topically. I didn't find it yet, but ozone will work again. Like you said, you can just
for rebuilding the gingiva.
Not rebuilding, but just to make it.
I'm not talking about pain. I'm just talking about rebuilding the tissue. Yeah.
Rebuilding the tissue. It's depending on the bone structure underneath. It's super simple. So there's this biological width. This is if you have a regular tooth like I have. There's no recession. Then you have this attached gingiva. It's about, let's say, 3 millimeters. This attached gingiva is where like the protection is. And this biological width, if you have periodontitis or it's receding, that means the bone underneath receded also. And it will always stop 2 to 3 millimeters above the jawline. So you probably need some kind of, if it's for aesthetic reasons, you probably will need a recession, but it's not so important for health issues if you don't have any inflammation. If the gingiva, even if it's receded, if it's still super tight around the tooth, it's no problem at all in terms of bacteria lurking in.
Oh, that's good to know. That's an excellent point. So thank you for sharing that. Are you going to be teaching again at the Health Optimization Summit in London this year?
Yes, I'm going to give a lecture there.
Oh, good. Well, we'll meet because I'm teaching there also in September.
That's 100%. Yeah, perfect.
Yeah.
Can't wait to meet you in person. Where are you living?
I live in Florida.
Ah, nice.
Yeah, on the East Coast, which is, I think, one of the healthiest places at least in the United States. I get the privilege of being able to walk on the beach virtually every day in shorts and no shirt and walking in the ocean perfectly grounded and getting sunshine. And my vitamin D level is typically over 70 all the time, and I don't take any oral vitamin D. So
I would love to have that. So I'm grounding myself all the time and working barefoot even if there's snow.
Yeah. Well, you can do it because you don't live in North America and there's not as much dirty electricity in Europe. And I would ground if I was in Europe too, but not in North America. So I have to ground on the ocean. Yeah,
it's so great that I've been to, I go to the US quite a few times, and I've been to Florida also.
Yeah.
And I'm going to Florida after the, I'm going to go to the Upgrade Labs event.
Oh yeah, you're going to be there too?
You too?
Oh yeah, I'm speaking. I'm one of the keynotes, yeah.
Amazing, then we will meet there already.
Yeah, it should be fun. I'm really looking forward to it. Yeah, that's the two big events is the Upgrade Labs and then Health Optimization in London, so.
Yes, I'm going to go to both. And actually, I'm going to be a +1 of Tim at the Upgrade Labs because I'm not speaking there. I'm just going there to see everything. And yeah, we call it the wolfing, like meeting all the other wolves for the wolf pack. Yeah,
it's fun. It's my favorite event, not so much because of the speakers there. And in fact, I really don't attend many of the lectures. I just love the people who go. I mean, I have such a good time hanging out with the exhibits and talking to people. It's just because everyone like you was very obvious when I saw you with your glasses on. You're committed to optimizing your health. You're not just trying to, the classic American strategy is to take this magic pill and just continue your pernicious evil ways that are contributing to the disease, and having insulin resistance, and you're not having an activity, but you're not really striving to optimize your health. So the people at these events, that's what they're doing. They're really in it for, full speed, and it's just really great. I've just never seen such a high percentage of healthy people in one place.
Yeah, that's amazing. And actually, last year I was always searching. This makes me also why I figured it out in retrospective. So wanting to become a professional skater was actually not about just skateboarding. I just wanted to hang with people that have the same mindset and just do everything they can. Now I am trying to be a professional doctor or health optimizer or healer, whatever you call it, and to find all these other wolves and these like-minded people. This is the most pleasure existing.
Yeah.
And we need to make, I call it the wolf pack. We need to have a wolf pack, and not like we had it like in Germany. It's a lot like this, that all these good guys, they're more like a little bit egocentric, or they don't share. So I want to share all my information. You can have everything for free. I only do this to spread the news because I don't have any impact myself. I can only do 30,000 surgeries. If you train 1,000.
Yeah, absolutely. I had the same conclusion. You can't see more than 100,000 people in your lifetime. It's just not technically possible.
Yeah, and I cannot even see so much because surgery is a little bit longer. So it's maybe
Yeah.
But if I train 1,000 dentists or other doctors to implement this, it's 30 million. So you can really change. And I think hanging with like-minded people, you have so many ideas, and you can really, I think nowadays with all the social media and everything, you can really change the world, at least for a few people. And this is the fulfilling part for me, so that I can help you optimize your health. And this is also, of course, the challenge I put onto all my patients, that they have to change their lifestyle. Otherwise, I don't even accept them, because then they don't have any good results. But if they have the results and they've seen 79 doctors,
that's the same strategy I did, 25 years ago, 1995. I sent a note to all my existing patients because I was a conventional physician in the mid 90s, and had put most of my patients on medications and drugs. And I said, listen, I've had a change of heart. I'm going down a new path. And unless you're willing to commit to getting off these medications, you're going to have to find new doctors. So I lost 75% of my patients, but then it wound up changing the whole thing. And I only had patients who were committed to health, and they got better, and the word spread. And I started seeing people from all over the state, then the country, then all over the world, like you. And they came in to fly and see me from all over. And and that's what happens when you're committed to doing the right thing, which is what,
This is, I can 100% agree, but if you have to be consequent. I train all my doctors, even people that are 30 years older than me, and it's just like, it's you. You have to decide what is your path, what is your vision, what are you going to do. So I just made this clear. I had this clear vision in my mind, and make this decision. And like you, I probably lost a lot of patients, and
But you didn't want it. They were holding you back. They weren't ever going to get better anyway.
No, and they don't want to, and it's not my responsibility. So I can just help you accelerate, but the commitment, basically, I cannot train. So that has to come from yourself. So being committed and doing it, because I have the tools. I can tell you exactly how to get lean. I can tell you exactly how to optimize this, and this, and this to at least reach a few levels. And if I cannot help you, I will certainly search another guy who has the tools to do that. But if you don't want to, I can help you.
I would put a little thought in your head that I think would have an enormous impact to literally hundreds of millions, potentially billions. And someone like you could catalyze it, and you can deeply appreciate it because you've got the kids. You have 3 children.
Yes.
And just to develop some type of comprehensive, simple strategy that can be widely adopted, throughout Germany, the United States, and where they change their behavior so they don't get cavities. Preventive dentistry to the ultimate preventive dentistry. And if a program like that could be implemented, I mean, it would be radical. I mean, that's going to be exponentially better than training them with all your finest surgical interventions.
Yes, I actually have the online course ready for this. So I made it. So I give the whole food and nutrition and everything seminar for specialists, so for dentists. But because of all the patients asking me, how can I follow up and everything, I just filmed a 3-hour like concept in this case, and it will be online pretty soon to just clone my knowledge. And also the Instagram we use, I just do Instagram. I don't do it myself. I just have the ideas, I write it down, and then we spread the content. I see it like this. When I was a kid, I was waiting every month for my new skateboard magazine. I was really passionate about it, and I would probably read it every day for the next month, so I would probably know it by heart. And I had this magazine idea for Instagram. So now my Instagram is more like this. I'm giving all this information from seminars and a little bit of topics from the book, maybe for cavities or maybe for root canals, whatever, or health optimization tricks. And if you learn, and it's there to help you learn stuff. And I think this will help a lot if you, it's just devote yourself maybe for 2 or 3 minutes a day. And if you do that every day, these little baby steps, you will learn so much. And luckily I'm able to do that now and can help as much as possible. But of course it needs more spreading because I'm just a tiny light.
Well, that's the thing. I mean, you've got the knowledge. It just what needs to be developed is a very sophisticated strategy to spread this. I mean, it really requires some creative inspiration and genius to make this happen, because the basics aren't that hard. It's just a matter of catalyzing a cause to change the behavior, so kids don't have to go through dental pain or ever have a cavity done or repair of surgery. It's just crazy. All this can be prevented. So it's also, like the need for dentists is like, I mean, we should have 99% less dentists, ideally.
Yes. So in terms of the reparation, 100%, you don't need it. You can use, but you could use it if the dentist would look at it differently and just look at the mouth as the mirror for your overall health. He could initially be a good doctor. Why? Because you have to see the dentist anyways. And if he tells you, because my patients, they come to me, sometimes older patients from my dad, and then they tell me, I have this and this problem. And I look at their teeth and say, hey, your teeth are fine. Here's your problem. Let's check your vitamin D3. And we're able to test vitamin D3 chairside. So in 10 minutes, I have the vitamin D3. And then I ask, in this 10 minutes, I will ask, how's your lifestyle looking like? What about your protein? Oh, you're vegan? Oh, you don't eat? You only eat once a day? And it's only vegetables? How would your body be able to build bone or build teeth? It sounds like you're catabolic. So I can totally reverse it and help people in this little consult to get back on their lifestyle. And also patients waiting long time. So you can imagine, I had a lot of problems with my dental colleagues for long years because, of course, I'm a pioneer in the field, and they kind of get emotional sometimes when they talk to me.
They want to take your license away.
No. I try to do everything as perfectly as possible.
Well, even so, it doesn't matter. I mean, I don't know if you know the history of it, but just for telling a that amalgam was potentially problematic, you could have your license removed.
And still in some countries, yes, I thought it's like this. In Germany, you would word it differently, but it's more like I don't tell this to patients. So now it's like this: they're informed, they're searching for me, they know exactly what they get.
Oh, sure, yeah. You're past that area.
I'm past that area, but for me, look at this: the dentists. So let's say 7 years ago, when I gave a seminar for 2 days of biological dentistry for 5 people. It was a blast. It was like-minded people. I had so much fun. And at the end, on the Congress, I gave one speech in front of 100 regular dentists on a huge podium. And afterwards, I would have get 30 minutes of emotional attacks. So I stopped that. When the book came out, and the book was not even my idea. The book was just somebody found me on YouTube and asked me, do you want to write a book? Because it sounds like you could help people. And I was like, oh, it's perfect for the mission. I will do it. So the book came out. And in this little town where I'm living, there's a huge clinic and there are a lot of dentists. And initially I got a shitstorm for 2 months and lots of newspaper articles about me and so really uncomfortable. You know, all this like way more extreme than me, but I know how it feels. And now 1 year later, it's actually turning a little bit around, and a lot of the cooler kids, I would say, the dentists in my age, the
skateboarders,
the skateboarder dentists, they're coming and seeing, okay, dentistry is basically just a little bit boring because the techniques don't change too much and they're not so difficult. But now you can really change and help people getting healthy. So the one part is the achievement side. It's a science. It's just like craftsmanship, like building Lego. That's it. But on the next day, if your patient tells you, oh, I didn't tell you before, but I was chronically depressed, and I had a neck trauma, I had this shoulder problem, this, and that, and 80% is already gone. Then it starts to get fulfilling, and patients wait for this. And I don't have any patient coming in that has to go to see the dentist like the normal dentists do. They're like, oh no, I have to see the dentist. I don't like you. You're the dentist. You have to drill a hole. It will hurt. You see, my patients, they're waiting for this. They are in the spirit as I am. And the other dentists, the patients, they hate it. So it's, if they would change to see that,
it's probably one of the reasons why the suicide rate in dentistry is so high.
Yeah, it always changes in between dentists and I think pilots or I don't know, stewards, stewardess, because it's always negative, and also you always have to deal with fear on a spiritual level. And you are way too close to the patient. So normally if I talk to you, I'm at arm's length, I would say.
Yeah.
But on a dentist chair, I'm like this. I have the patients here. So I'm in their total aura. And of course, if I don't protect myself, I breathe in all the toxins they anyways have. I work with all the toxins. And of course, the dentist, if they're not taking care like I did in the first year, I intoxicated myself.
You got exposed to so many mercury vapors.
The first year, because now I'm using all these masks, but the first year, I just protected all my patients and I was drilling it out like crazy the whole day. So I get exposed at huge levels of mercury. So that wasn't a good idea from my side.
No, so unless you want to repeat Hal Huggins' strategy,
Yes, no. But he has a good speed. He has a good one. He said, detoxing your body of heavy metals while having amalgam fillings in your mouth is like showering and trying to dry yourself at the same time. I like this one.
Yeah. He was definitely another pioneer. So
100% pioneer like Weston Price.
I think we should begin to wrap it up. So why don't the name of your book again is It's All in Your Mouth, which is available pretty much anywhere where you can purchase a book. But what are the other resources where people can find out more about you and your clinic? Yeah,
of course, the website is danesthetics.de. Maybe you can put it in the show notes if you have that.
Oh, sure. Yeah, sure.
Otherwise, I have to spell. Then you can just YouTube my name, Dr. Dominik Nischwitz. There's a YouTube channel. I'm on Instagram. It's at DrDom1, DOME1, where all this little tiny content's there. And of course, I'm the president of the ISMI. That's the International Society for Metal-Free Implantology. It's maybe more for the dental colleagues. But you basically just can Google my name and find my area. I'm going to speak at the Health Optimization Summit this year.
Yeah, we'll meet in person because we're both speaking there.
And we will meet sooner in...
at Upgrade Labs in Beverly Hills.
Yes. And afterwards, I'm actually also in Florida for a week or so. That's amazing.
Yeah. Yes, indeed. All right. Well, thanks for all you're doing. You're a real pioneer, a real inspiration to many others, and making a difference, and really being a rebel and having the courage to go up against the conventional dental community and, really create a new path and strategy to get people healthy.
Thank you very much for saying so. I give my best.